In 2015, Bill Gates stood on a TED stage and warned that the world was highly vulnerable to a fast-spreading respiratory virus. He pointed out that our global systems and international coordination were far too weak to stop it. 5 years later, COVID-19 emerged. The global system fractured exactly as predicted, and intensive care units worldwide overflowed as nations scrambled to respond to a threat they had been told was coming. COVID-19 followed a rigid historical pattern of ignored biological warnings, one that has repeated itself for over a century. Before the 1918 Spanish flu, researchers who studied previous outbreaks warned that a highly lethal influenza strain could emerge. Those warnings went unheeded, and the resulting pandemic killed between 50 and 100 million people. Decades later, the emergence of SARS and MERS served as distinct signals that novel coronaviruses were crossing the species barrier from animals to humans. We managed to contain them, yet treated them as individual events rather than dress rehearsals for a larger crisis. Because ignored biological warnings historically lead to mass casualties, the decision to deprioritize them creates a systemic failure that leaves the entire population at risk. In 2018, the World Health Organization added Disease X to its priority list. This is the official placeholder for a pathogen currently unknown to science that has the potential to spark a severe international epidemic. The mechanism that creates a disease X is called spillover. This happens when a virus that has evolved over millions of years inside an animal host suddenly jumps into the human population. We are actively accelerating this process. By clearing massive tracts of land, we strip away the natural buffers between wildlife and human settlements, forcing disease-carrying animals directly into our backyards. We've also built perfect biological mixing vessels. Intensive farming packs thousands of pigs and poultry into confined spaces, creating ideal conditions for viruses to rapidly mutate and swap genetic material. Once a spillover occurs, our modern infrastructure guarantees it won't stay local. Global air travel ensures that a localized outbreak can touch every major continent on Earth in less than 36 hours. Disease X is a mathematical certainty, currently incubating in the specific environments we have engineered. Right now, the primary active threat scientists are tracking is the highly pathogenic H5N1 avian influenza. This chart shows the estimated case fatality rates of recent viruses. COVID-19 killed roughly 1 to 3% of the people it infected. Documented human cases of H5N1 have a fatality rate between 50 and 60%. The virus is now establishing itself in U.S. dairy cattle herds. This expansion into livestock brings H5N1 one step closer to achieving human biological compatibility. The final remaining barrier is efficiency. H5N1 has not yet evolved the genetic ability for sustained human-to-human transmission. With a virus this lethal actively multiplying and mutating in our agricultural systems, intercepting that genetic shift the moment it happens is a critical requirement for preventing a global catastrophe. Yet the global commitments made in the wake of COVID-19 to build that exact network are actively being abandoned. Crucial programs are facing severe cuts. USAID's pandemic tracking capabilities, which monitor the regions where spillover is most likely to occur, are being dismantled, alongside sharp drops in international health funding. Real pandemic defense requires 4 specific components: global surveillance, rapid diagnostics, 100-day vaccine platforms, and binding international cooperation. As funding is slashed, the surveillance and cooperation pillars are crumbling, blinding our global early warning systems at the exact moment biological threats are accelerating. While scientists are successfully developing prototype vaccines in labs, the physical manufacturing infrastructure required to produce and deploy those vaccines globally within 100 days remains incomplete. If the historical pattern proves that unheeded warnings lead to mass casualties, and we are currently defunding our defenses against an escalating threat, what evidence proves we survived COVID-19 only to learn nothing?